Good afternoon. Hope all of you are doing well. Today I want to talk to you a little bit about new health initiative or agenda that I have been thinking about for the last few years, but in particularly for the Gulf region. That is a region very dear to me. I've been to Dubai, I've been to the Gulf region. I've seen what amazing work they're doing in terms of development and infrastructure in their countries, and the healthcare system and the education system, and so many good things they're doing in the Gulf region, in the UAE, in Qatar, Bahrain, Oman, Kuwait, Saudi Arabia, so on and so forth. Thank you. And but first, maybe you're hearing the ocean around me because I'm sitting right on the ocean. So just to show you this place here, where I am right now, this beautiful cafe is one of my favorite cafes that I come to here. Give me a great inspiration to come up with great ideas and talk to you. And by the way, those who maybe don't know me, my name is Cody Michael. I work in the raw material business, and we roam the world looking for the best raw materials for supplement, for health supplement, to help nutritional, holistic doctors and ND doctors and homeopathic doctors develop the world's highest quality supplements. We don't use anything from China or synthetic raw materials. So what I want to talk to you about today is something pertain to healthcare initiative or agenda. Since the Gulf region, my brothers in the Gulf region are investing in AI and new technologies in stock market, building new cities in Saudi Arabia, and they're always open-minded to expanding their horizons and their investments. I think is one of the most important and investments and one of the biggest market in the world that is missed by many of the investors and countries around the world, that is actually bigger than all the annual oil sale combined. Thank you. Annually, thank you. Is actually healthcare market. In the United States, our healthcare expenditure have exceeded right now the $5 trillion mark. And we know the power of Big Pharma. And by the way, this video for informational purpose only, based on my own experience and my own connections and data that I gathered from Google and many others, working with as a subcontractors with Johns Hopkins, with so many holistic doctors, and also we have supplied some of the raw materials as a subcontractor for Los Alamos Lab, for Alabama University, etc., etc. And we have met many researchers. We have watched many presentations about health research that some researchers took them 12 years to complete. And some of these health presentations were 2 and 3 days long, that you have to watch like 3 hours every day or 4 hours every day class in order to understand the 12 or 15 years research that they have done. Like Dr. Kensler, Dr. Jed Fahey from Johns Hopkins, etc., etc., who had also helped the NASA research nutrition team and was part of the nutritional biochemist. And that's very important because there's not a lot of nutritional biochemists around the world. Based on all this research, based on what's going on today with Brian Johnson, who had spent millions of dollars trying to pinpoint the problem and the health benefits from specific nutrients, what happens when you give specific nutrients to the body, what happened to the heart, what happened to the liver, the kidneys, the cognitive, the telomeres, the oxidation process, the ROS, the inflammation, etc., etc. Today, Brian Johnson, he's monitoring about 50 biomarkers, and we also have other amazing holistic doctors are monitoring only 8 biomarkers. One of the main biomarkers really to watch is, thank you. One of the main biomarkers to watch, tea is amazing for your health. Thank you. Is blood sugar. And of course, oxidation, cholesterol, cortisol, etc., etc. If we can keep those 8 biomarkers in check and within the level that we want them to stay by using specific nutrients and keeping somewhat a healthy diet. It doesn't have to be a perfect diet, somewhat healthy diet, but in particular trying to keep people away from specific artificial sugar like corn syrup, fructose, and artificial sugar. That will help a lot. So with the knowledge we have, my Dr. Bruce Ames, my professor who discovered the Ames test in 1988, who passed away in 2024, had done extensive research on nutrition and showed what you call the triage theory, how the body takes certain vitamins from certain parts of your body to put it back again. For example, when your vitamin A is low in the liver, it takes vitamin A from the eyes and put it back into the liver. We know today, we have research that women who had low or deficient or low on vitamin C and low on omega-3 and low on folate, they can have health problems with the baby before it was born, because the mother health and the father health of his semen determines the health of the baby. One of the students that had done research with Dr. Bruce Ames was working on his thesis, and he was able to see some of the people that he had done research on, that their semen had DNA mutation. And these DNA mutation related to specific nutrient deficiency in magnesium, in selenium, in vitamin C, in zinc, etc., etc. And when they took that person and they start giving him these nutrition-specific nutrient back again to his body, within 17 to 18 weeks, it start to balance, it start to top up the tank for up to 80% within 17, 18 weeks. Of course, you can't fix things in 1 week, because it takes people sometimes to damage their body 10 and 20 and 30 and 40 years. So you need sometimes to fix all this problem. That's why it's called preventive healthcare. That's what holistic doctors do. That's what ND doctors do. That's what homeopathic professionals do. So preventive healthcare is you don't wait till you get sick and you have to go take that chemo or that radiation or something like that, which costs, we know, a tremendous amount of money and can cause harm also to the body. And by the way, this video for informational purpose only. But today we have Dr. Dr. Seyfried, who was a researcher and also a doctor for cancer, who used to treat people with cancer patients with radiations and chemotherapy, etc. Today he developed a holistic method called the ketogenic diet that starves glutamine in the body. And by starving glutamine, you can starve cancer. If cancer still exists within a few weeks, within 7, 10, 20 weeks, then he can use maybe specific medicine like chemotherapy or radiation, very small amount to target specific area in the cancer to heal the cancer with the specific protocol diet that he is using without harming the body. We know also today that a specific diet for women that they were eating and they had, for example, a specific nutrient like omega-3, like folate, like zinc. They had higher, for example, their omega-3 was higher than level 8. Their babies, they had higher IQs than the other women that they didn't have that level of omega-3 at that level. We also know that athletic performance today depends on nutrition, and we can prove that with so many different research. One of them with biochemist Greger, who was working with insurance companies, who showed how he can improve athletic performance based on nutrition and diet. And he can also predict people's death when he used to work for insurance companies based on their nutritional deficiencies. He can measure a specific medicine can cause a specific disease and will make somebody immobile or sick at certain levels that they will need a knee surgery when they take specific medicine for arthritis, for example, within 5 years after they take that. And they can literally measure when someone will die based on how much deficiency they have in vitamin D, for example, and how much medicine they're taking. You can check biochemist Greger, who helped one of the known fighter in the MMA, how to reduce his health problems and his inflammation and take him off the CPAC machine. We have all these research that we can put in an AI system, and we can maybe run a focus group study or clinical trial on 3,000 people maybe in Saudi Arabia or in UAE. And we can monitor how that works, and we can keep them at bay. And if we can have a healthier population, more intelligent population, more athletic, performant population, that population will be more fruitful, less sick, less needed of medicine, and they need less healthcare expenditure to be spent on their health because they are into a specific health protocol prevention. Once you establish that data, that might cost maybe $150 to $200 million, that you put the right team together, the right researchers. Already the research has been done out there. All we have to do is put it together. Those who say there's not been enough research done on nutrition, I can tell you there's a lot of research been done on nutrition, including from the Navy, including from Los Alamos Lab, which is not available to the public because it's considered national security, and we have some insight on these information and this amazing knowledge. So now once you establish that, within 3,000 to 4,000 people, you can monitor for the year or 2 years. You establish a protocol that how much you are able to save on healthcare, especially when the United States today, they passed a $5 trillion budget. And you can take that protocol and apply it to your population. Decrease healthcare by 50% within 5 to 6 years. We know now the healthcare budget around the world, it is most of the biggest health budget in any country around the world. And you can take that system like UAE doing today. They are managing, for example, the ports, many ports around the world, and doing a great job with it. So you can take that healthcare system that we create as an initiative agenda for preventive healthcare and help contract with the United States government and other government to lower their healthcare costs by 30 and 40% in 5 or 6 or 7 years. In return, you will get billions and billions of dollars for the service you're gonna do that originally cost maybe $150 million or $200 million to establish, based on all the research out there, based on the research was done by Brian Johnson, who had spent millions of dollars, based on the research done by Johns Hopkins and by Dr. Bruce and Ames and by Dr. Linus Pauling and by Los Alamos Lab, how to produce, to help bring the healthiest population, most athletic performed population, most intelligent population, that population lived the longest with the least amount of disease without the need of spending of billions of dollars on nursing homes in the last 5 years of their lives because they can take care of themselves. It's been proven over and over that by many researchers like Dr. Joel Wallach in his book called Dead Doctors Don't Lie, showed that 3,500 sudden death syndrome in the United States that he had done autopsies on from all types of people, short, tall, black, white, old, young, and found out that the single reason for every single death for the sudden death syndrome was a lack of micronutrient and trace minerals in the body, and the heart ran out of fuel to keep running 100,000 times a day. Guys, the research is out there. The longevity issue with Dr. David St. Clair from Harvard Medical School that we know. He showed that without an NAD in the body, a person can die within 30 seconds. But also, we know back in the 1800s, more than 2 million British Navy died from scurvy, vitamin C deficiency. We know that Jacob Teitelbaum and Dr. Gottlieb had done extensive research on vitamin D and showed the massive health benefits when somebody topped their vitamin D above 50 and the negligence of vitamin D being below 30, how much it can cost healthcare and cause diseases around the world, including death. We know that beriberi is caused by vitamin B deficiency. So the vitamin deficiency caused all type of health problems, including death. And recently there have been tests done on rats in the United States showing that rats cut off vitamin C from their diet and they removed the genome that produced vitamin C and replace it with a human genome 5 that doesn't produce vitamin C. was able to live only half of their lifespan, which is 2 years. And then when they start introducing vitamin C to their water, back again, they start living the 4 years full lifespan. There are so many things we can do with AI technology and put all this information together and develop a system. The healthcare agenda will be the golden goose in your hand that can cost 150 to 200 million dollars to develop. A precise science that we can take that protocol and sell it to the world as a healthcare agenda contractors to help lower their healthcare costs around the world, and that could bring billions of dollars in assets to your country. So I hope someone is hearing this today and seeing that the biggest market in the world is not oil and it's not real estate, it is actually healthcare cost. Is the biggest expenditure in the world, and it's going to increase every day. More air pollution is coming in around the world, more toxic air, more wars, more people, more air, water pollutants, more junk foods, and we know the junk food that we eat today, Western man-made diet, is addictive, and the world cannot stop eating it, and the disease is going to increase and increase and increase. So I hope someone is listening to this, because we can help put the right team together and use AI to put all this amazing information into specific protocol that we can sell the world and show them that this model worked in Dubai, worked in Saudi Arabia, worked in Qatar, and how we can reduce healthcare costs for their country and their population within 3 to 4 years time. So shalom from heaven. We are here enjoying our day. What a gorgeous day. And we are munching today on some ice cream, some tea, and Mom, what are you having? Oh. Wish you were with us, guys. Wish you were with us here. What a beautiful day in paradise. Can you enjoy life if you're not healthy, my friend? Health is wealth. And hey, what can you say? Bon appetit.